All right. Good morning or afternoon, and thank you for attending this presentation. Again, my name is Derek Adler from the RUTGERS Molecular Imaging Center, and today I will present some of the scans that we've done here on the M2. The Aspect M2 was installed in September of 2011 and formally began tracking its use in 2012. From July 2012 to May 2021, over 85,000 scans have been completed here at RUTGERS, with over 6,000 hours of MRI use between July of 2012 and May of 2021. Data produced from this MRI has been used in over 40 publications from RUTGERS investigators. To date, at least 2 grants have been associated with MRI use. Over 10 students have completed their PhD thesis utilizing this MRI as their project on their study and research. Excuse the stutter. We've had over 450 projects for patients. Since the M2 was installed, over 60 departments and over 100 researchers have used the MRI. For today's presentation, almost all the analysis was done with VivaQuant, though you will see some PMOD, MATLAB, or ImageJ. You're also going to see other instrument images such as ultrasound, ultrasound, PET-CT, and other instruments for co-registration. Unless noted, all of these images are without contrast, and for most of these images are either fast spin echo or gradient echo. Here are some examples of hours of instrument scans. As you can see, the maximum we did was about 950 hours in 2013, while due to COVID, we had a slowdown to about a little under 400 hours for 2020. Here are some publications by year. And again, thanks to the slowdown of COVID, last year was very productive with at least 9 publications utilizing MRI data. Here are some local universities and examples of people who use the MRI here at RUTGERS, such as the Cancer Institute of New Jersey, Robert Wood Johnson, University of Medicine Dentistry, assortment of RUTGERS departments such as chemistry, food science, entomology, genetics, engineering, comparative medicine, and others. Other universities that also come here, such as Princeton, NYU, Stevens, Del Valle, Chicago, Rowan. And we also have some big pharma, small pharmas that utilize the M2, such as Johnson & Johnson, Colgate, Alizé, PTC Bio, Physical, and others. This is just an example of our setup here at RUTGERS. So the MRI, center of the room, small Gaussian field. Small footprint. This instrument has been great for our 2D and 3D imaging requirements. And again, normally in vivo, ex vivo, in vitro studies. Here are some examples of studies completed at RUTGERS. Everything from lung mustard, fibrosis, flow measurements, toothpaste, multiple cancers, skin grafts, uterus scars, tooth extraction, fetal monitoring, brain development. We've had animals from NASA, sudden death, and others. Examples of animals that we've used in the MRI, your typical mouse and rat. We have scanned zebrafish, koi, lizard, bees, spines. We have actually done quails and snails, vegetables, skin grafts, human placenta, and more. So I'm going to start off with examples of brain imaging and CNS imaging. So the first few series of scans are from traumatic brain injuries. There are several models of TBI injury here at RUTGERS. This study specifically was measuring the ventricular volume over time post-injury. The objective was to see a decrease in swelling of the treated animals versus the control groups. Continued. In this example, you can see the point of impact from the device that caused the traumatic brain injury. Each numbered box up you see indicates a slice from the MRI. Again, the red arrow is indicating the point of impact. In this slide, we reviewed the herniation caused by the TBI procedure. Over time, this inflammation and swelling decreases, while we also observed at the same time the internal inflammation would increase. This is an example of traumatic brain injury, and we're looking for leakage within the ventricles. In this model, we're looking for leakage in the blood-brain barrier. In order to measure this, we utilize both fast spin echo and gradient spin echo scans. The fast spin echo was used to determine the ventricular volume over here. Next, a baseline GRE was completed in the brain. Magnivus was then injected through a tail catheterization while the animal was still in the MRI. A second GRE was completed. By comparing the intensities pre and post scan, we were able to observe where the magnivus leaked into the brain. This change in intensity was then overlaid onto the ventricular FSE scan. Where the signals matched, there was leakage into ventricular space. So as you can see from this example, we did the ventricular space in blue. In this case, you can see the leakage into the brain or change in the brain as green. Where the green and blue matched was leakage. Here are additional examples of the leakage into the ventricular space. As before, the blue is ventricular space and green is the change post-injection of magnivus. All of these images were generated using Viviquant software. So again, variant stages or variant forms of leakage post-injection. We're going to move on to tracking stem cells with a negative contrast. These animals had an injury at the top of the spine. Stem cells with a negative contrast tag were injected near the base of the spine. The purpose of the study was to track the stem cells as they migrated up the spine to the point of injury. Images to the center and right are examples of images taken over 42 days of monitoring of the migration of the stem cells to the point of injury. In addition to having negative contrast tag, the stem cells are also had an optical component. So example E here, image E shows an example of our optical imager overlaying an X-ray of the spine. The bright red signal here you see is the stem cells traveling up the spine. Those same stem cells have also been applied to our traumatic brain injury models. Here's an example, again, that the stem cells were injected IV and migrated to the point of injury in the TBI model. The following slides are taken from an investigator who was funded by NASA. The purpose was to see the stimulated effects of low levels of radiation that an astronaut would be exposed to when traveling between Earth and Mars. These rats were scanned looking for variations between the control and various levels of radiation. The next few slides are examples of the effects to the brain. All scans were completed using the 60mm rat coil. This slide shows the different effects of the radiological doses. Ventricles and brain volumes were measured and compared versus control. Some variation of ventricle volumes could be observed. So in this case, our group 1 is control. Group 2 through 5 are different levels of radiation exposure. As you can see, the increase for some of these models of the ventricular inflammation. This one example is of a brain lesion that was found during scanning. Using a modified cradle, the animal was scanned in our MRI and then scanned in our PET-CT. The MRI and PET images were overlaid utilizing the PMOD analysis software. In this example, the lesion did not uptake any radiological glucose, so possibly a benign tumor. So here's an example of the MRI scan. Here is the MRI PET overlay. Here is the PET-CT image. And here is a 3D rendering of the brain, and the red is the uptake of glucose. Additional rats were scanned in both the MRI and PET-CT after observing the abnormalities in the brain. Here are some examples. In this case, group 1 are the control brains. Group 3 is the one you saw prior, group 1. And group 4, rat 1 and 4, are examples of ventricular abnormalities that we observed. So over here, and some stuff over here. This slide shows examples of utilizing brain mapping from PMOD analysis software to review 32 segments of brain. For these animals, we were able to review the glucose uptake in the brain, post-PET, and measure the intensities of the pixels of the MRI scans. Images were normalized using Viviquant analysis software prior to being transferred to PMOD. This is an example of a paralysis model here at Rutgers. One of the more interesting MRI tasks here at Rutgers is to do phenotyping or vet services and look for differences in a model. In this example, we were presented with a newer strain that was having issues as the mice developed. At a certain point of growth, the mice slowly became self-paralyzed. The mice were scanned using our MRI and our CT. Other than large bladders, which can be observed during paralysis, we were uncertain what was the cause until a void was observed in 1 or 2 points of the spine using the MRI. Voids in the MRI image can be either air or bone. Then we compared the MRI and CT scans. It was observed that these animals were spontaneously developing bone spurs in their spines, which we believe was causing the paralysis. The image to the right is a 3D rendering of the CT image and the abnormal growths into the spine. This is from here is a wound healing model example. This slide again is an example of wound healing bed sore model with patients suffering paralysis. The top 2 pictures are an example of an animal that had a injury, but with no spinal injury. So what you're seeing here on the left is before contrast injection of a wound. The wound is right here. And then 10 minutes post-contrast, you can see that the magnus is flowing to the wound area. Notice how the wound brightened post-injection. We repeated the same study in animals that had a spinal injury above the wound site. So again, below, here's your injury. And then 10 minutes post-contrast, notice that there's really lack of signal where the injury was. Repeating the study, again, showed lack of signal post-injury. So, okay, we had some sort of model going on where for some reason, signal of healing wasn't received at the wound site. As these animals healed over time, we noticed an increase quickly of signal back to the wound site in the non-injured, non-spinal injured animals. And it took much longer in the spinal injury model. Ultrasound scans of the same animals not shown showed a much quicker return of vasculature with the animals without spinal injury than the animals with. We are now going to transition onto some cancer imaging. Give me 1 second. Oops, let me go back. Just an example. No, it's not behaving. All right, that was going to be an image of some lymphoma that we'll get to later. So first cancer I'm going to go review is lung cancer. There are several departments here at Rutgers that conduct lung cancer imaging studies. In this example, we are able to see where we injected a lung cancer. As you can see, the cancer slowly grew over time and began to cause inflammation as in the left and eventually both sides. Technical difficulty. All right, so as you can see, tumor was implanted and we tracked over time. Tumor continued to get increased in size and as well as the inflammation to the lung. In this example, we see a group is from a group that has developed a laser scanner that uses rare earth element tags. They often use our instruments here at the center and compare it versus their laser instrument. In this example, the mice were implanted with lung tumor cells and observed for 5 weeks. Week 1, the MRI could detect both the tumor while the laser did not. By week 5, the laser and the MRI were both able to detect the signal. Now, the eventual advantage of the laser unit they're trying to develop is it only takes a quick pass and could be something that could be hooked up to a surgical visor. Eventually, this is meant to be translated into a device that can be used directly during surgery to look and visualize a tumor location. Here's an example of a negative contrast that we study here at Rutgers. The purpose of this experiment was to visualize hard-to-see tumors within the liver. So here you can see liver without contrast. It was to determine that the tumors were not taking up the negative contrast, but the liver was. So for this study, the negative contrast was used to void the liver so we could specifically focus on the tumors within. Here's a prostate cancer model. This example is from the longest study I was involved with here at Rutgers. So here's your prostate cancer, control, another cancer example. The mice had a very slow progression prostate cancer. Initially, the mice were scanned weekly, then monthly, then the final scan with other indicators it was time for the animal to be removed from study. Some mice were on this study for over 2 years before the study was ended. After each scan, the prostate and the tumor volume was measured and tracked over time. Most of the animals on study were removed from age-related issues and not the cancer itself. Here's an example from lymphoma. This study was tracking lymphoma over time. A lymphoma tumor was implanted in the left arm lymph node over here. After a certain amount of time, the primary tumor was removed. The cancer would continue to spread from lymph node to lymph node, then eventually into the internal organs. Like other studies, this animal was studied, monitored daily, and scanned weekly until removed from study. The objective of this study was actually to contain the lymph node in the initial implantation site. So you see here's the initial implantation, week 4 after the tumor was removed, and then we tracked the progression of the lymphoma over time. Here is an example of a pancreatic tumor that we observed. For this study, the mice were initially scanned in the MRI to confirm pancreatic cancer before the animals were scanned in an ultrasound study. Here is an example of colon cancer. These examples of colon cancer and polyps that were used tracked here at Rutgers. Sorry for the stutter again. The difficulty was determining the cancer locations versus other signals in the region. In this example, arrows indicate locations where confirmations of polyps were. In this example, all arrow locations were confirmed upon necropsy and histological review. These scans were completed using fast Scintica. Pituitary tumor. Here are 2 different studies and models that track pituitary oncology in mice. The top examples were small tumors with minor impact in the surrounding region. The bottom examples were more aggressive in nature and were larger and had more effects in the surrounding tissue and brain. Breast cancer. This study utilized a spontaneous tumor development model in retired breeders. So here you can see different examples of breast tumor development in these rats. The cancer was tracked over time while medication and treatment was applied directly to the surrounding teat and tissue. The model, in combination with optical imaging, was able to visualize cancers versus healthy tissue prior to biopsy or mastectomy. Here's an example of melanoma. We are able to distinguish and quantify some of the tumors on the exterior of these mice. So here's your MRI scan. And just for point of reference or clarity, the example to the right is a 2D X-ray of the same animal using our optical imagery. So here's your ears. Here's an example of the tumor in the ears optically, each dot being a melanoma. As mentioned prior, we often do scans in conjunction with our veterinary services. In this example, the animal had a random paralysis. So upon imaging review, it was determined to have some sort of growth or cancer mid-spine that was affecting mobility. A bone cancer example. Normally in MRI, the bone is black. In this case, a tumor was observed in the left femur. Actually, this is tibia fibula. But, all right, so as this tumor was tagged optically, we're also able to review it. The images on the right show an X-ray of the mouse, and you can see the damage to the bone here. Upon injection of luciferase, we were able to see the tumor here as well as 2 other metastases. The image over here is just an example using our nano-CT to review the tumors from the other animals. All right, this is an example of lung cancer metastasis primarily in the liver. Scans were completed using the fast Scintica scans. The mice were also reviewed with an optical tag, so we were able to compare from instrument to instrument. So again, this was a lung cancer study with metastasis. And as you can see, different examples of the tumors in the liver as well as other parts of the body. The example on the left and center was from a uterine cancer. An in-house contrast was used to observe the signal in the uterine horns. So this is pre-contrast and analysis. The example on the right is a tumor in the heart, either caused by metastasis or improper tumor implantation. As the tumor also had a fluorescent marker, the tumor was confirmed using optical imaging. In this model, we're reviewing an oral cancer that forms under the tongue. The bottom two rows are from a control mouse, while the top two rows are from a mouse with a possible cancer. These scans were used in the mouse brain coil. So again, example, a healthy mouse, no oncology. While the top images, you can see starting the swelling and development of something under the tongue. Here are additional examples of the oral cancer model. The top row of images are controls or mice that failed to develop the cancer. The bottom rows are all mice that had tumor development. As this is a study in progress, the next phase of the study is to observe if an oral medication will reduce the tumor burden in these mice. Cystinuria. This model studies cystinuria. Cystinuria is a condition that's caused by the amino acid cysteine to build up in a child's kidneys. When the cysteine builds up, it may form bladder stones, kidney, or ureteral stones. Please note the dark spheres in the bladder and in the kidney. Now, we had a few cases where the cystinuria had caused a thickening of the bladder wall and possible tumor development. This is an example of one of the many projects utilized by one of our students. This was a student reviewing the lung tumors over time using a combination of Viviquant and then a self-created script in MATLAB. So with the program he wrote, he was able to auto-threshold lungs and then track them mouse to mouse, subject to subject. Let's see if this one will play. My auto player doesn't seem to be working right now, but this is an example as we move to other interesting scans here done here at Rutgers. This is an example of a lung scan where the lungs were injected with a fine intertracheal mist of magnetist, which gave us quite nice details of the lungs. Ah, it's playing. Okay. A lot of projects that we have at Rutgers are dealing with lung scans of fibrosis or edema. With an MRI, you can quantify the edema using a T2 weighted image. Control lungs are essentially negative signal, while the edema water is a very intense water signal. You can then capture the signal of the ROI and then quickly determine the volume and intensity of that edema. In longitudinal studies, you can follow the resolution of edema over time or in response to any type of therapy to see if the resolution is increased or decreased. So here's an example of vesicant day 1 and then tracked over time versus control where say it was PBS with some slight signal on day 1 and then nothing subsequently. We use both FSE and GRE to review lung fibrosis and edema. While the FSE shows the initial damage of the edema, the remaining damage can be seen better in the GRE after the edema is no longer present. This was another student's analysis project. Using automated thresholds and a saved region of interest, she was able to review the same ROI over time. Note the control lungs with no inflammation versus the damaged lungs below. This model was reviewing fibrosis in mice. The images from left to right are fast spin echo, gradient echo, a combination of the fast spin echo and gradient echo. a 3D rendering of the lung tissue versus the fibrosis, or edema in this case. And then a CT scan was done of each individual mouse and compared. Mouse 2 was the control, while mouse 1 and 3 had various fibrosis within the lungs. The voids observed in the CT scan show the damage to the lung tissue. We're moving on to some fetal studies. This example was reviewing particles that cross the placental barrier post-inhalation. The picture on the right using the fast spin echo shows a few pups at day 14 gestation. The picture on the left shows the same pup with the arrow after fixation in formalin using a fast spin echo and gradient echo scans that were then combined. Here's an example of accidental finding. The animal was on study for lung cancer. Full body FSC showed several fetus developing within the stem. Our last example is of Chagas disease. Chagas disease is a tropical parasite disease caused by the Trypanosoma cruzi. It is spread mostly by insect known as the kissing bug. Up to 45% of people with chronic infection develop heart disease 10 to 30 years after the initial illness, which can lead to heart failure. Please observe the fat pad by the heart. Now, I've observed this fat pad in hundreds of scans without second thought, but in this study, for whatever reason, post-Chagas infection, that fat pad disappeared. Using Viviquant, we were able to analyze the wall thickness of the heart between Chagas and control mice. Chagas patients normally have an enlargement of the ventricle as the disease progressed. I'd like to acknowledge the labs whose images were used in this presentation. And I'd also like to special thanks to the following people who directly contributed to this presentation. Now I'm going to hand these things back to Gabrielle, and please ask your questions. I know I went through this a little quick. Thank you.
Thank you, Dr. Adler, for the spectacular discussion. I will now hand over the presentation to Tanya for a quick poll question, and later we're going to move on to the Q&A section. Thank you.
Great, thanks, Gabrielle, and thanks, Derek, for the wonderful presentation. Again, as Derek mentioned, if you have any questions, please feel free to use the Q&A dialog box at the bottom, and I'll work through those questions with Derek in the time that we have remaining. As you start to think about those questions, we do have a poll question that we wanted to run. I'm going to launch that now. Just wondering if you would be interested in having us reach out to discuss the system and your research, specifically the M series or any of the other imaging equipment that we represent here at Aspect Imaging. So different options. Happy to reach out with you and set up a call in the next couple of weeks, or if your time frame is longer and you're off on vacation into the fall. Alternatively, we have recorded the webinar, so we'd be happy to send along that link. And I know some people like to attend the webinars, especially during these times of the pandemic, and just to learn more about interesting equipment. So please feel free to enter that there as well. I'll give everyone just a couple more seconds to respond. And if you have responded, just keep thinking about questions, again, using that Q&A dialog box. If you're having any issues with that, you can use the chat window. I'll look at both as we go through. So I'm going to end that poll question. Thanks again for answering those questions. So one of the questions that we have is, can you estimate how many mice you saved by using MRI to measure the tumors, to use that same animal in a longitudinal study as opposed to sacrificing them or measuring them manually?
I would have to say hundreds. Almost every study we do here at RUTGERS is a longevity study. So it's not just scan it once and remove the tumor. It's take an initial scan, track over time as the animal was treated. So it's not until the end that, or some predetermined time point, that the animal is sacrificed and the tumor is sent for histology.
Agreed. When doing the analysis, there's a couple of questions around that.
Okay.
Is there different software that you would use? Or I think you mentioned at the beginning, Derek, that you're typically using the VivoQuant software to do all of the analysis for the different organs.
At least for our system, it came with a copy of VivoQuant, which Rutgers adopted. So I would say, again, 95% of all of our analysis is done using, at least initially, with VivoQuant. And then subsequent analysis, such as using MATLAB, which our students here like to use, ImageJ, or in the case where we're doing a combination of PET studies and MRI, our main analysis software for PET, we use VivoQuant, but for brain mapping, we use PMOD.
Perfect. And with the color overlays that you did to measure volumes within VivoQuant, were you using any of the automated tools within VivoQuant, or were you doing those all manually?
We did use connective thresholding or global thresholding, yes.
Perfect. Great. And did you have to draw any of them by hand? The subsequent question is, if you were doing them by hand, how long was that taking? And I can also jump in to talk a little bit about VivoQuant as well, if you want, after your answer, Derek.
We would normally use manual just to touch up where, say, connective thresholding or global thresholding may have caught something that didn't belong. Or in the case of, if you remember, the liver tumors from the lung metastasis, there was at some point where we had to be manually going through the livers to find them. I mean, some tumors could get down to 0.4 millimeter. But normally, depending on the animal, I'd say analysis was anywhere from a few minutes to maybe a maximum of a half hour on our more complex studies.
Yeah. Yeah, and I know from my experience with VivoQuant as well, so I've worked with the system quite a bit. There's so many different tools within the software and different, as Derek mentioned, connected thresholding or global thresholding, and different tips and tricks that the team at VivoQuant have to help make that faster. To Derek's point, at times there's a manual kind of perfection of those techniques, if you'd like, to make sure that they're accurate, to make sure your volumes are representative of what you're seeing. And I think for me, the amount of time you invest depends on the preciseness that you want and the power in that data, as opposed to being a little bit more slack if the differences that you're going to see are a lot bigger, has been my experience.
Going back to that question, say some of the lung thresholds or the lung edema, it's just a click. We pre-know the thresholds that we're looking at. Let's have a simple SOP, you can click and it goes, versus say the most complex is looking at the leakage in the blood-brain barrier, where you're first doing fast spin echo, doing the volume of the ventricles, then doing your GRE pre and post, and then subtracting the images to get where the contrast changed. Then combining your fast spin echo ROI with your GRE ROI and looking at segments.
Yeah, that would be an involved one. I know within the software it's nice because you can load those multiple different sequences and choose to display them or not display them as you're doing the analysis. So I think the software is quite robust in allowing you to do that type of analysis. A question about one of your PET MR studies. So obviously your PET separate from the MR, but you obviously scan the same animal. With the FDG marker that you used, were there any tumors that you found that you missed, perhaps due to the low specificity of that agent? And did you find tumors on MRI that were missed on PET?
Just let me pull up the NASA one. 1 second. Why? For some reason I can't find it at the moment, but
no worries.
1 second. I was in the CNS. To answer your question, actually we did find some tumors that were not shown here, that the MRI, we saw something but wasn't certain, and then we did have some glucose uptake of certain parts of the brain that we weren't expecting. Then we went back and looked at the MRI and said, yes, that was something that to our naked eye, we weren't certain what it was.
Right. Yeah, it's definitely helpful to have complementary modalities to verify what may be some ambiguity. Ambiguity? I'm having trouble with my words today. there's one other question that has to do with systems of aspects offerings. So Derek, I'll grab that one.
Okay.
But to anyone else who has questions, again, please feel free to use that Q&A dialog box. But the last question that I have relates to, obviously, Derek, you talked a lot about the small animal imaging side of things. And the question is surrounding, is there a system from aspect to do non-human primate imaging? And so the system that Derek has is called the M2, which has been renamed to the M5. And basically that system allows you to do mouse and small rats. There is an M3, which is small mouse only, and then the M7, which does mouse and rats. Aspect recently has developed a clinical system. So this was specifically designed for neonatal brain imaging on humans and used in the NICU to look at preemie babies and challenges that they may be having because of their premature birth and differences in the brain. That system has been considered and is kind of in the process of being launched as a preclinical system as well. And so there is a coil that could be used on the brain of non-human primates. And it's something that perhaps makes sense for us to talk a little bit more directly, but there is some work going on there with that larger model to move it to the preclinical side of things. So Crystal, I'll follow up with you directly after the fact so we can talk a little bit more about that directly. But if there's any other questions, again, please feel free to use either the chat or the Q&A dialog box. But at this point, I will thank Derek for taking the time to pull together all of those images. I know the core does so much work at Rutgers, and it's quite amazing the variety of imaging that Derek's been able to achieve using this system. And hopefully you were able to see some examples of images that you would be doing, but then also see the breadth of applications of the instrument and perhaps consider your colleagues and maybe they have an interest in doing MR imaging as well. So at this point, I'd like to thank everyone for your time today, Derek for the great presentation, Gabrielle for hosting with me, and I hope that everyone has a great rest of their day.
Thank you. And thank you for attending.